Hi, you guys. We're going to go ahead and get started. I'm Dr. Maureen Hayes from Galveston, Texas, and I am joined by Jim and Ann Glenn from San Antonio, Texas. Jim's our big money man, and Ann is our beautiful nutritionist and personal trainer. And of course, we have the illustrious Dr. Lee Osler on, author of 4 books now, and dentist extraordinaire up in Washington State. Has an incredible past history, president and founder of AOSH, just got back from Las Vegas where he wooed people with Redox signaling information. I thought I let my dogs in when it's scratching. I got to get him in a
That was funny.
In any case, we have a fantastic show for you tonight. We have Dr. Ed Dela Reyes. You know what? I've been practicing your name. I was listening to Alan Noble say it. Ed Dela Reyes is with us from Bowling Green, Kentucky. He has an amazing background. He was triple boarded before he retired, pediatrician, anesthesiologist, and pain specialist, kind of like me and my husband all mixed up in one. Just absolutely fantastic. Has an incredible story. Like so many medical professionals, he was introduced to this because he had a personal need of his own. We're going to let him kind of go back and tell the story about what was going on with his own health challenges. But before we do that, let me stop. And Dr. Lee, you want to come on here and give the disclaimer while I let my dog in?
Yeah, I'd be happy to. We could say who lets the dogs out, right? But
yeah, right.
Welcome, everybody. We are representative. We're independent associates of a company called ASEA Global, headquartered out of the Salt Lake, Utah area. And we have a supplement that they brought to market that does not cure or diagnose or prevent. And so we want to make that clear from the outset that this is a cellular health supplement. And we're going to be talking more about that with Dr. Ed as we get into this. And maybe I could just kick this off and invite you. Ed, would you please, there's people who will be watching this or who are viewing it presently who may not understand who you are or know where you came from, why you're even with us. Could you give us a brief intro to you and perhaps explain what it is that caught your attention and why this becomes important in your life at this time?
Yes, thank you so much again. And I'm really honored to be back here with the CF5. You guys are great, and you guys are helping the field the way my own group is being helped, and you provide the science to each and every one of us that is doing this and sharing this passionately to the field. And again, thank you, and it is a great honor to be with this. For people that are always been a leader in giving information to this field, to the world, actually. Yes, I am originally from the Philippines. In 1983, I migrated to the U.S. I am a foreign medical graduate there. But as a foreign medical graduate, it's always our hope and dream to be able to be trained right where all our books are written, right where all our systems are made. So in that year, I came here, I took my boards here, and since then, I've been a licensed physician to practice medicine in the U.S. I went into pediatrics first, and then I was going to start my neonatology fellowship when a friend of mine convinced me to go to anesthesia. So I did another residency. And then after that, I went and did interventional pain management as a subspecialty. Before I went there, I was going to be a pediatric anesthesiologist because I was a pediatrician. But I became in love with the specialty of chronic pain management. So that's why I'm here. And so I've been practicing in DC and from 83 to 2005. In 2005, I moved to Bowling Green, Kentucky, and then helped out the pain practice. And then we were successful in building it from 1 clinic to 6 clinics. And that was a great achievement. And of course, after that also, it kind of broke my back. And I'll tell you my story, why I got involved in this one. So every time we do procedures, we wear a 20-pound jacket that that protects us from X-ray radiation things. And so from 6 procedures a day when I came in. We built it to 40 procedures a day, and that's how it was very taxing to the back, and doing all those things by yourself. And then, but we rotate though. There's 7 of us that rotate, and but in 2015, I came home from a long flight, and then all of a sudden I have this severe discomfort that I felt in my back. It went down to my right foot, and I kind of have an idea what it is. It's within my specialty, and these are the kinds of things that we see. And so I have my back image, have a picture, and then so after that procedure, I went with my wife to the mall, but the radiologist called me right away, and just about 10 minutes after he read it, and he said, "You need to see a neurosurgeon as soon as possible." So I have a neurosurgeon friend. I called him and I said, "This is the description of what was seen by the radiologist. What do I need to do?" And he said, "Yes, he's right. You need to have this things fixed as soon as possible." But I have a bias. My specialty is chronic pain management, and most of my patients procedures like this one that were not successful, and I just don't want to be one of them. So I said, no, I'm not going to do that. So it took 5 other new spine surgeons and neurosurgeons that I have to talk to convince me that I need to have it done. So I did. I was convinced. All of them were unanimous. Yes.
Ed, what I've had only 10 back surgeries. What were they looking to do, if you don't mind me asking?
They were fusing 1 level, and they were gonna decompress 4 levels, and then fuse it and have rods and have bone plates and screws, and that was done. And so and I kind of really didn't want to do it. But of course, I was still in the traditional medical things, that these are the things that we needed to do. So I submitted myself for that procedure. I did my research. There's a center in Philadelphia that is their specialty is just this one, a repair for this. In fact, my surgeon's specialty is to put football player back to play after spinal injury. So I said mine was not really nowhere from that spinal injury, and my cousin who works there as an anesthesiologist gave me a tip that this is the guy that has the most success rate, and he's the best. And so I chose him, and he has a 90% success rate. Unfortunately, after the procedure, I belong to the 10% failure. And so after that, he told me that we could redo this as soon as possible. And I said, no, I think I could just help myself with this one. And we x-rayed. He did not really everything's good, but because I don't feel good, we're just going to redo it and find it when he opens it, whether we could see something. But on x-rays and imaging, everything went, it looks good. So I said, no, just keep it that way. And so in short, after that procedure, I became a patient of my own specialty. Why is that? Because instead of getting better, I was worse. I was placed on 5 medications, and to take care of my sleep, to take care of my severe pain, I had to be given 2 controlled substances, and then I have to be given medicine that would confuse my brain that there's no pain in there. And I was given anti-inflammatories. I was submitted to physical therapies and acupuncture and all these kinds of things hostile. So I was on those medications that I prescribed myself for the last 30 years. And then, but it did not help. I could not be comfortable at nighttime. Every hour, this discomfort in my back would wake me up. I have to change position so that I could at least have rest from this severe discomfort. So Every hour I wake up, every hour I wake up. And this was my life all throughout. I was told by my surgeon I could no longer work, but I was not ready for that. I cannot accept it. So I continued to work, and I kind of have a little privilege that I could choose what I'm going to do. So I dropped my pain practice. I just manage nurse anesthetist to do procedures. I run the schedule in the operating room, and but I would need a walker to go to work and to ambulate. I have a walker, and I was on this medications. And
Hey, Ed,
yes,
if you don't mind, I like how long were you like that? I mean, from the what period of time were you like? I mean, I'm reliving it, unfortunately.
um,
Um,
yeah, it's more than a year before I saw it's exactly 14 months before I met Asia, and then and at that time, so I refused these things every time I have my follow up. This second procedure was offered, and I always refuse it until the time that I had my annual follow up. At that time, I was already frustrated. I was already discouraged, and depression had hit me. I could not function well. I could not really think well, but I insisted that I just need to be there. But at that time, if you, my thoughts really just give me a scalpel, I'll do it myself. I'm gonna open this back, let this monster out of my back, and I would have relief. So I agreed to have a second procedure at that time after my yearly follow-up. So it took 2.5 months for the surgeon to have a space for me. He was a busy one, so but that worked well for me because it was at this time that I was introduced to ASEA. And then the thing is, it was my brother-in-law who is not in the medical field. He was an accountant, and he just had a great experience with a CEO with his wife who's been asthmatic and diabetic, and this conditions were and these conditions were really taken care of, and their wife almost reverted back to normal instead of having this thing. So they shared about it. They heard that it can do some things for the discomfort, and it was my wife's brother, older brother. So culturally, we respect our older brothers. We just say yes and yes if it's an elder that would tell you. So I he just wants me to take it, and I said okay, I'm taking it. And for me, I was just respectful. That's all. I was just I show respect, but deep in my mind, it will never work. And they said, okay, let's just keep on doing the let's just start doing this. In that way, I could tell him, I'm sorry, I tried it, but it really didn't work. But to
Ed,
my surprise, yes.
okay, the logic. How much were you drinking? Were you applying the gel? What was your routine, and did you take it
Yeah.
correctly?
I'm a guy. I'm a cheapo, so I just took the minimal things. They said to just take 1 cup twice a day, and that was the only thing I did. Rub the gel in the back 3 times a day. That's what I did. So I just did that one and drink this 1 cup twice a day. And after just 5 days, I have the best relief ever in my sleep. For the first time in more than a year, was able to sleep for straight 4 hours. And for me, that was kind of heaven. That I undisturbed sleep for 4 hours. And I remember that well. 10 o'clock, I slept. At 2 o'clock in the morning, I woke up and I said, whoa, I thought it was still 11, but it's already 2 o'clock in the morning. And then, and I was well rested. At 2 o'clock in the morning, I was ready to do a lot of things. I was ready to go to work because I'm just rested. And for that first time, it went. And I said, "Well, what happened here?" You still can't believe the stuff of things. But the next day, same thing. And the next day, when I woke up, well, already I'm well rested. So my brain fogness and my focus, my mental things is it's getting better because I got rested. But not only that, it's sharper, and my demeanor and my depression slowly was just improving and improving on a daily basis. It's kind of a gradual thing and all these kinds of things that's happening, but it's gradual within the period of 2.5 months that I was waiting for back my back procedure. Within this period of time, my sleep got better, my mental clarity was there, my depression was relieved. There's joy in me now, and I am just so happy about it. But within that period of time, I hated those medications that I'm on. I was able to wean myself from this. I weaned myself first from the controlled substances that I was on, and that was it. The last one that I was able was the anticonvulsant, of course. You got to make it slow to get off on that one. And then I waited just few days before I decided I'm gonna cancel this second back procedure. And I was able to do that. I called my surgeon, and then this is it. I was able to cancel it. So at that time, I was not a believer in it. And now that I am a changed person, a changed life, at this time I said, whoa, this is 100% placebo. And I'm still not a believer. I'm still skeptical. This is placebo for me. And that's what it is. Until, of course, I shared it with my mom. My mom was 90 years old. 4 years before that, had a brain condition that took away her speech. And I just want her to experience the good sleep. I just want her to experience the good energy, the joy, the thinking, the concentrations, and everything in it. And that's all I was hoping for her to have. And then because it gave me a lot of things. So even if I was not a believer, I said, that's just maybe mom would also be lucky like me. To my surprise, after 2 weeks of just taking also 2 ounces, 1 cup twice a day, and then we rub the renew wherever the parts of her body is aching. And then in just 2 weeks' time, slowly her speech came back. Words, phrases to back the conversational speech. That was kind of an eye opener for me. I could not explain it in my own medical knowledge. Why 4 years of brain insult would still have a recovery thing. I could not explain it. I did my research about redox signaling molecules. What is this? When I look at it at that time, there were already 200,000 articles about redox signaling molecules at PubMed. And then I still could not understand it. Biochemistry was not my favorite thing. And then it led me to the medical atomic physicist that stabilized these molecules. Dr. Gary Samuelson, we talked for hours and hours because I could not believe it. And he shared to me what he has read about the studies before he stabilized the molecules, how he reviewed it, and all these things. And with that, and the thing that caught me is when he shared to me that because operating room, you're very, very excited when they said, oh, this was supposed to be a surgical wash. It's a bactericidal, virucidal, fungicidal. But the thing that really caught me is what really caught Vertis, when he said, you have something in here that kills organism, but at the same time promotes cellular repair. I said, what is this? Until now, I'm still trying to get an answer. This might be part of the the secrets that they have, but nobody can tell me these things. But you can't mix that. Most of the cytals that we have, like Clorox, of course, it destroys cells. That's why you got dead bacteria, dead viruses, dead things. This one would do that, but at the same time would repair the cells. So I'm searching, maybe a few years from now, we'll see. It's connected to the oxidative stress, the resiliency that is afforded, that it weeds out the thing. And the other thing that kind of make have a lot of questions in my mind is that yes, it kills bacteria, but it preserves your normal flora. It kills pathogens, but your normal flora is there, it's preserved. I said, this thing, the molecules in here works in synchrony with the body. It identifies things that are within the body that is needed by the body, and it will not touch it. If it's a pathogen, it's something that's invading and it should not be there, it takes care of it. So those are the kinds of things that kind of mind-boggling. What is this? But of course, you come from this kind of field that is everything that we do, we discuss, we refer to journals, we get studies. How many studies is that there? Oh, how big is this study? Oh, it's not too convincing and everything. And then here we are, we have really limited studies compared to where the field that we came from, and Maureen and Dr. Lee. But you have less studies, but you have more results. You have on other sides, you got a lot of studies going on. And then when you try it on things, the results is really not there from what they say in the studies. But here we have few studies that are better, although solid, but just few, but we have a lot of results. We have things that's happening, just like me. As I take this, I've been taking this since early, the end of 2016, and then 17. And now I've never missed it. And I on a daily basis, I take it, I bring it. First time that we traveled to the Philippines, one luggage when there was still no product in the Philippines at that time we traveled. One whole 50 pounds luggage was just a sea of water and a sea of things because I can't be without it. And as I take it on a daily basis, and as it progresses to years and years, there's just so many things that happens to my body positively. See, I'm 69, I'll be 70 next year, and we are elderly. We carry a lot of maintenance drugs that we have. And in this kind of age, every year your maintenance drug is just increases and increases and increases. But this one, it's every year, it's just like you're taking away things. You're taking away medications. You're cutting down on doses. You're cutting down on things. Pretty exciting thing. And that really is the one that excites me and all these things. And when I had this personal experience of mine, my wife had a personal experience of having a cut and was told that your fingernail will never go back to its normal things. That nail bed was really cut down and you could never recover that. That will always be a deformed fingernail. And we just soak it with this thing. And we just put Renew 28 and it healed completely as if nothing happened. And those are the kinds of things. And I was a pediatrician. My 18-month-old granddaughter had an injury in the first and second layer of the skin just because of a very hot water. And then it caused that injury. It caused sloughing of those first and second layer. And I remember from the talk with Dr. Gareth Samuelson that, hey, this Renew 28 is really good for discomfort, for that thing, and it's good for this kind of condition. And I put it in. Within 30 minutes, my granddaughter was playing while we were driving to the hospital to have her taken care of. And within a month, she healed. And I was a pediatrician. I could see these things. They would scar, and at a minimum, they would have a skin discoloration. But this one did not. It fully recovered. And that is what the thing that what the wonders that I see, that when these things would work, completely repair the cells, it put it back to the way it was before. And that's just what I am observing this. So my family had great relief with it, great effect. And then but when I started sharing it with my friends, and one of the neighbors of ours came to the house just for a referral, asking for a good surgeon to take care of his frozen shoulders because he was already referred. Nothing they could do. Physical therapy, chiropractic, everything that they've done did not work. So he just had to go. And I gave him a gel, and I recommended the water. And then just a week, calls me and says, "What is this stuff?" For the first time, he could brace his shoulder, he could brace his things. Until now, he still didn't have surgery. So this kinds of things that you are able to share, we have a lot of things. I am, when I talk about a lot of things, I'll start not to be compliant. I talk about my own language, and I don't want to do that. But it touches so many lives, and it is a technology that changes the way we should think about affording relief on people's condition, on how can we bring them back to what their body should be functioning. They should be functioning normal. They should be doing these things. All the systems should be able to communicate with each other. We have a hormone that is really well orchestrated from the brain to the pituitary to the thyroid to the ovaries to the things. It's a lot of organs to control all the other hormones, and it should synchronize and communicate each other properly so our body can work better. But with stresses in life, with different stresses, and stress is not just psychological, it's not just the physical things that we do. Pathogens like infections is a stress. Toxins that we put in our body is a stress. This distorts that human role of repair and managing the whole human system of communications and properly working. And that's what we call as hormesis. And that's what we call as redox environment that needed to be balanced. And that kind of thinking, and of course, when we were trained, we were just trained to think by system. If something is wrong with the brain, so the central nervous system, you diagnose it by system. Then this cardiovascular system, you diagnose that. And most of the time, we don't even think cross reactions. Sometimes, of course, we do when nerves, but nothing like this. That if the rule of redox balance is not there, then the body cannot work well. And then if you just put it back, then the body can work the way it should work. And now we have something that can do that. And how do we know? Because when I had these effects and I see it with my family, I am just trying to find a reason. How could this be? Why is this? And then when you read about those studies from here and that, then you said, you know what? This is the paradigm. This is the change in the thinking of how we get this, how we get ill. How do we get to have our system not functioning well? And then when we leave it that way and there's no corrections to it, then it would cascade into different abnormalities. The system breaks down, then the other system breaks down, then the other system breaks down, and so forth. That's why when we get older and we don't correct that redox balance, and we don't provide things for that one, then this cascading of abnormalities just happens. And as an elderly, that's why you increase your medications on a yearly basis. But once we have these things, then slowly it will repair. It will repair, and it will repair, and it will repair. And that's why you're going down on your meds. You're discontinuing a lot of the meds, and you're functioning. And that is my hope, that we should not be, because I am always there. I'm thinking about nursing home or retirement home or retirement community. And I think we could skip that. We could still be functioning well. We could still be able to take care of ourselves before the good Lord is going to take us home. And that is just my hope, and to share with everybody, that because that is how we feel. Me and my wife, that's how we feel. And when we go to reunions and we see our classmates, we see things, wow, it's really true that we are moving much faster. And for me, I have this screws and rods and thing on my back, and most people would just like Jim, 10 surgeries. And our category is just, you're there, you're disabled, you can't do a thing. You're just on meds and just be there. But to be able to be on that stage and to be able to go back and do things again, just like you were doing things before, it's just a God-given gift to be able to restore us the way the good Lord has created us, not restoring us by human things. And this is still, of course, because this is a breakthrough that brings us back the way the good Lord really has created us, to have that inner doctor in us activated, and then our bodies can function the way it was created. And
so, Dr. Ed, I want to ask you a question also, Dr. Marine. I'm sitting here listening to you talk about how you spent decades in healthcare as a physician, triple boarded, and you didn't know about this. You had to go through this almost tragic, to serendipitously come across it, perhaps. Maybe it was a great blessing. However, it's like it didn't happen when you were 25 or 30 when you were in medical school that you learned about this. So why is it both of you could respond? Explain, because there's got to be people listening to this and hearing two bright doctors here, physicians, admit that they didn't know this, and they're wondering if their physicians know anything about this. They're just over there in their own little world recommending more drugs, more surgery. And I'm not here to say that any of that's wrong. There are times when intervention is necessary when the systems do fail. So we have to be balanced there. But just explain, because there's people wondering why people that are so smart like you didn't know about this.
I'll let Maureen answer first, since I talk a lot already.
Sure. I had not heard that verbiage. And, it's interesting that you say that. I got introduced to this in 2012. And now, as an anesthesiologist and pain specialist, just like Dr. De La Reyes, those are the things you're concentrating on. Those are the journals you're reading. You're keeping up with it. You're doing your continuing medical education and all. And Dr. De La Reyes, you had said something about the different systems. We have gotten in medicine almost like, you can put the system in a basket. This guy's got the heart. This guy's got the lungs. This one has the kidneys. And sometimes we do forget that they're all connected, and we become very, very super specialized. Being a chronic pain management physician is a super specialty. So you get a little hyper focused. So something like redox signaling, which is cellular biochemistry, and it was a fairly new field of study. Even though it's been around for a couple of decades, they were not using that terminology. The first, molecules, redox signaling molecules that were discovered was nitric oxide, and there were Nobel Prizes given for that. So what happened for me when it was brought to my attention, just like Dr. Del Reyes, it came from someone who was not in the medical field, who was telling me about it and telling me about how people were having these responses to it. And I had a conversation with my sister, who is not a doctor, neuroscientist, anything. She's a medical editor at my medical school, the Medical University of South Carolina in Charleston, South Carolina. And I said, this person told me about something called redox signaling molecules. I've never heard of it. And she said, well, I have. And I was like, no, you have not. How could you? If I, as a physician, haven't heard of it, you certainly haven't heard of it. And she said, no, we just got a $10.5 million NIH COBRA grant to study redox signaling in the body. Now, these are the innate molecules, the in vitro molecules that are in the body. For cardiovascular effects, neurodegenerative, orthopedic, aging, cancer, diabetes, all sorts of things. They were studying how these things worked in the body with multidisciplinary. Sent me the press release for it. And I was like, this is incredible. Here, this guy, Terry Latham, who had a background in computer sales, he knew about redox signaling. My sister, the medical editor, knew about redox signaling. I had never heard of it. Now, just like Dr. Del Reyes was saying, when I went and looked on PubMed, which is, Google for healthcare professionals, there were at that time about 6,500 references to redox signaling biochemistry. There were already journals out about it. I had just not been exposed. And there's going to be a lot of physicians who have not heard of this or have not been exposed to it because it's still such a new science. And you were also talking about how we have limited studies, but a lot of effects. And that is so incredibly important. In fact, when I met with our founder, Vertus Norton, early on, my husband and I both, my husband had a health challenge, but he's also a researcher. And he has done, many written grants and done many studies. And, his lab was the one that grew the lungs outside of the body and transplanted them into pigs, so real bench research. So talk about being cynical, skeptical and cynical. And we met with Vertus and, we were kind of pushing for FDA approval and things like that. And he said, we could probably get it, but it would take 10 years and another $10 million to get it. And we've all, the companies had already spent millions on safety studies and all these other things. And he said, we know what it does. We know how powerful it is. We know it's 100% non-toxic. We're going to take it to the people and let them have it and let science catch up. And that's what's happening now. So if you haven't heard of it, you probably will in the next, it may take another 5 years or so for it to become mainstream, maybe even longer. But now universities are coming to us and asking to do studies with our product. So things, that pendulum is swinging out the other way. You're going to hear more and more. We're leading the pack on all this because nobody else has been able to stabilize these molecules outside the body like this company has. So hope that helps.
Hey,
that's pretty.
Maury, can I, the fact that no one else has it, all of you, does that make it harder to believe? Because no one else has it? I mean,
what a great question. You know what, to a certain extent, I guess that makes sense. But our company is so smart, the leaders in our company, because intellectual property, you're hearing about different different information being stolen by other countries and things.
right.
And even, I know my husband, when they're putting research out, they have to be so careful because somebody can actually, beat them to the punch or use their information to recreate their studies and whatnot. So, this company has layered patents on, it's made from salt water and you can't patent salt water, but you can patent the process that they use to turn salt water into something else, into these redox signaling molecules. So they have layered patents, but patents run out. So for a while, they were just sort of covering them and layering them and putting more. we also have thousands of trade secrets, so many little tiny things that somebody, if they didn't know, they wouldn't know to do certain things that can have a big effect on the molecules themselves. And they've refined a lot of these things, and they've made things better and better and better. And, it's impressive. We have 3 on-site laboratories, 2 at our production facility and 1 at headquarters, where they're constantly testing the product and improving the processes and all. It's just absolutely amazing. So this is a real research and development company that puts our products out to market using the word of mouth marketing that we use. So, great question. I think everybody is probably trying to do this or trying to get around it, because we're now learning more and more about what the effects of rebalancing this. And of course, Dr. Lee is the resident expert on the redoxome and what that balancing and punishing it is.
So you guys are 3 amazing doctors. You have amazing testimonials, and with you, Dr. Ed, do you go and share this with any of your contemporaries? And how have they responded? I mean, this is phenomenal. What you said, that first your talk was unbelievable. And how can your contemporary look at that and say, whatever it is, are they doing that?
Yeah, when I was when I first had an effect, and I kind of verified that this is it. It's not a placebo. It's not something that just happened because of me. It's something really that there is something here that decreases inflammation, that improves your well-being, and so I shared it with my partners before, and partnership is terrible. You got to have a unanimous decision for these people to use it, right. And when you talk about it, and it says, where's the studies that would do, that study, how many subjects were there? Oh, not a lot, and everything. And I said, you know what, guys, I'm just going to wait until you guys come to me and then ask for these things. And most of the time is that's when I went. When you go to colleagues and do this like that, it's either they look at you and say, oh, wow, what happened to you? You went into the other side. You just broke your back. Now you are on the other side for these things. But I could not get it out of my things. Just like 3 weeks ago, I was on call in the hospital, and a colleague of mine, a nephrologist in the hospital, called me and then, hey, can you help out my mom? This is what she has. She suffers, and then you're on call, and I'm glad you're in the call. And they know me as a guy that does pain before I retire. So she just wants me to take care of her mom. So I went up there. Of course, he responded right away. This is the parents. And while I was going up there, and then when I saw her mom, how she suffered, I said, I can't do this. I cannot do this anymore, giving just steroids into my patients. Mm-hmm. And I know it's just going to take care of her now a little bit, and then after that, it's going to end. When I look at her chart, she is on a chronic steroid use, and that I cannot do this. Add more to it. So I just put my white coat down and I said, I am here as a friend. This is what I did with my own self. And if you were my mom, this is what I'm going to do to you. And I did. And for the first time, and I was making rounds, I said, I'm not going to write anything in the chart. I am just here as a friend. And she's still using it. And then, of course, my mom insisted when she got discharged from the hospital, the practice just put more blocks and everything, and nothing worked. It did not work. They did facet block, epidural, they did radio frequency, and it's still nothing works. I said, be patient with this. Increase your dose, and it will work, because I'm telling you, if I was doing this for years, I've been injecting people's back, I've been putting gadgets on people's back, And I'm telling you that this is the thing that works. And just be patient with it because it will. And then if you still has these things, just increase your dose.
Okay, Ed, can you dig into that maybe with you and Lee? Because you
Can I-
said something that I want people to hear. Go ahead, Lee.
Yeah, let me just interject one thing here because we started the top of the program making a disclaimer that we're not treating. And this the word that he used a few minutes ago about compliance, we have to stay compliant, is an ever thing here, and he's doing a wonderful job at it. But there's a lot of people who wonder like why we even speak of it this way. Well, Dr. Ed made a comment a little bit ago about the inner doctor, the inner healer. And the whole point of what we have is that this is a cellular health supplement. And these interventions that we do in the medical and the dental and health care world, we do because the cells haven't been working well for a long time, and they finally just run out of whatever, they run out of their steam. They do need an intervention. That's when drugs and surgery are needed for many of these conditions, just to put some of the fires out and the symptoms to go away. We all want to feel good. But the reason why, in my view, the reason why we're hearing these stories and we're impressed with them is because what we're doing is we're making the cells function like they used to function. And when they function right, then everything downstream from that works better. The analogy here is we go into a home or a building and there's smoke in the room and the smoke alarms are going off, and we're very annoyed by the smoke alarms, and so we put fans up to get the smoke out so that the smoke alarms will quit firing. But we don't take care of the smoldering problem that created the smoke that caused the alarms to kick off. And that's a really good metaphor for describing if we went upstream, if we went into the foundation, if we went behind the wall and we took care of the smoldering thing in the cell that had been that way for ages or years or whatever, and we dealt with that at its functional level, then we wouldn't have these issues show up. Now, obviously, there's things like trauma and events that have to be dealt with. But when we're talking about chronic disease, chronic degenerative issues, and so forth, it's because first there was a cell that's not working. So the whole premise that we're making here, everybody, is that when cells don't function properly, these things, the risk for these things goes up, and there's a myriad of things that can happen. But when we can restore, when we can do something with lifestyle, with supplements that re-engage the cellular metabolic pathways, the pathway genes are now telling the DNA what it needs to be doing differently and what it should not be doing anymore. Then we have these outcomes where we have less dependency. That's what Dr. Ed was saying. We can start moving away from some of the interventions because we're preventing now. So I just wanted to make that clear. That's the basic premise of what this is about. It's cellular health.
Yeah, very good. So I was going to mention, you were talking about when you first started, you followed the bottle, 2 ounces twice a day. As you aged and been on it now 7 years, we've been on 8. Have you gradually went up just so you could see, because everyone will vary, just so you can see other things improve, or are you now at 6 or 8 ounces? Where are you today?
Oh yeah, I definitely have increased. And then the reason why I was smiling, because actually it's Jim that really inspired me when I decided I'm going to do this. I'm going to see the factory and everything. First time that I visited the factory, I saw Jim there juggling a whole bottle of Bacia, drinking this stuff, and I said, "What? You could do this thing?" So they have this 2-ounce cup that were there. So I just pick up 3 and take some 3 shots for that one. So at that time, I was still using 2 cups, 1 cup in the morning, 1 cup at nighttime. And then from a pain level of 10 to 6, I was happy. And then from not walking without a walker, that was heaven for me. But of course, after 300 yards, I had to stop and then rest because it's just too much. But it's a big improvement already. When I did that on that day, that I just took 3 cups,
Yeah.
one time, I toured the whole factory, not stopping at all. I went down and I said, "Wow, there is something in these things that really it's doing good when you increase your dose." From that day, I increased my dose to 4 ounces twice a day, and that's what I'm on. And then when we had a scare, my PSA just went up to the things, and my wife just put the bottle in me. You drink this things for this whole day. Finish this one bottle a day.
Awesome.
And then we did, and I did. And the thing is, there's more things that happened when I did that one. I did it for just a week, of one bottle a day, but it's just like a lot of energy is there. And then after that, I have my blood exams, and it went there. And then what we're trying to do about the PSA level coming down, it did came down. And then my cholesterol levels was always been abnormal. My dad died at age 46. He
Oh,
has this
wow.
condition that we as a family cannot really metabolize cholesterol. And so and I was on high level of cholesterol meds. And I could not tolerate statins. So I was on 4 milligrams of this Livalo thing that cost me a copay of, he said that's the best that insurance would do. It's $300 a month is what I have to pay personally for this meds. And I was on 4. Now I'm just on 1, and I got cholesterol levels and LDL levels that are really just like a 30-year-old levels. And those things that you cannot, I could never, for the years that I've been taking this and taking my cholesterol meds and everything, I'm always at the high normal, and that's the best I could do with that 4 times a dose. Now I'm just 1/4 of a dose, and I am really below even average for these levels and things. And that makes me so passionate about these things. If I haven't seen this, my dad died at 46. I'm 69 now. I'm just so thankful that I'm in these things. And then I haven't had a cath lab things. My last examinations for my heart was in 2007, I think, and I have a 50% blockage already at that time.
Wow.
Never had chest pains now, and I'm still. I wanted to have another cath just to see how is it clean, or where did that 50% go? And because I don't, and I'm not really watching my diet. I'm just eating what I can, and then
Dr. Ed,
yeah.
why did you have a cath done? Was it because of your family history and your high cholesterol, or?
Family history, and at that time, I also have an uncontrolled high blood pressure. That's why the cath was done. And then with my history, and then complaining, and this, I have a high tolerance of pain, and sometimes I have some chest pains, but I cannot quantitate whether this is really a heart chest pains or not. So my cardiologist just wants to make sure, because of history and my condition of uncontrolled high blood pressure. And that is another thing that uncontrolled, that my cardiologist cannot take care of, and my primary care cannot take care of. This blue bottle took care of it.
That's right.
Okay.
I had one more quick comment, only because I want to let you share on that part. But you were talking about, y'all being, specializing or, focusing on the heart or the brain, or as you were talking about in the beginning. And I'm really think of just Jim's scenario, not other people. But I know for Jim, he had steroid after steroid, and it was always a bandage. And then he had, I was with him for 9 of 10 surgeries. So I've watched him over the 22 years together until ASEA. He was always on something. And the focus of the back doctor was, okay, we'll distract the brain so you think you don't have anything, going on. And they don't mention that, oh, by the way, as you're on this, you may start seeing the brain and the other organs, the pretty important organs, getting affected. So they bandage him. Again, it's not every scenario, but for Jim, it was always something to mask. But they don't mention, oh, you're going to have a hour and a half nap and you're going to miss time with kids and you're not going to have quality of life. But fast forward today, he hasn't seen a MD for 8 years. I haven't seen one for 10. We hike, we ski. He has his life back that he didn't have before. And so it's just, if people, I heard somebody this morning say, if they could just experience what the redox signaling does, they'll be a believer. Doesn't matter all the science, doesn't matter all the papers on this. If they could, like Jim or myself, experience the changes, they'll be a believer. And so I just think it's sad as I watched him. I mean, he's like night and day today because of like you are because of the molecules. So,
okay. So, tying into that, if I'm a normal, you guys are all doctors. Lord knows my dad was, but I'm not. But people get confused because it says it's a dietary supplement. I'm speaking to the masses. And then they go to the back and go, my gosh, it's salt and water. They put it back down. How did you handle that, Ed, in the beginning? Or was it just your older brother-in-law that yes, sir, I'm going to do it. But speak to the people out there that are going, come on, guys. Salt water is a dietary supplement, really, and it tastes like pool water. I mean, on top of that. How did you deal with that?
Yeah, it's very expensive too. Salt water. And
Maureen has a bunch of it down in Galveston. She said she could go pick up anytime.
I know. Right? I live on an island. I don't need to.
You had it all around you.
I put my own salt water in a blue bottle.
I dare you. Give it a shot.
That's and that's a good thing that happened to me, because if I was investigating this before I drank it, I would never use it, because I would just go into the thing and I would go into my own comfort zone of where are the studies for this one and how was the studies done, how many subjects were there, and I said, this is very weak and everything. I did not go to that route. I did not even care about it because I know 100% it's not going to work, but it worked. And then it worked on my mom, and that caught me. And I said, I need to study this. I need to look at this deeper because I already have results. I just need explanation on why did it happen that way? Why did it work that way? And in my own thinking, in my own training, we were not taught that way, that there was some kind of a general thing that happens to the body that needed to happen before things can work. And we were just taught about, hey, that's a system on the peripheral nervous system. You take care of that in that way. But to give something and then achieve that whole message that we are achieving, to make the body more resilient to these things that are really bombarding them, then you could function normally. And that is the thing that bugs me. So when I approach people, is that, hey, it's salt water. Of course it's salt water, but you measure the salt in there. There's almost no salt in this thing. It's 125 milligrams for 4 ounces. That's the only thing. What happened to the salt in there? It's converted to this molecule.
Right.
It's that's what you have in that bottle. It's not really salt and water. It's the molecules as a result of that main ingredient that was made. And people would just give me some more studies. I said, no, just drink it. if you just drink it and just apply it. I like Renew 28 because Renew 28, you could let them feel that there are molecules in here.
Quick.
You literally let them feel in 5 minutes or 10 minutes that there are molecules in here, because you test them before you put it in, and then you test them again, and nobody could believe it, that what's happening to their body immediately in that things. 3 times in 5 minutes for any discomfort, and 90% of the people, 95% of the people would have relief with it. That's the easiest way to let them feel that there are molecules here.
Yeah. Real quick, Lee, I don't know if Lee or Dr. Ed, but some people respond quickly, like you did. Many do, but many don't. Lee, why will you say that this has to work? It cannot not work. Please, because people may get on this, they may stay on it for a whopping week or 2 weeks, even though they said, oh, I'll give it 3 or 6 months, and well, it didn't work on me. Can you please quickly answer that?
Well, Ed made a comment earlier about random controlled trials, and we always want to see more studies and whatnot. That's never going to happen with this, in my opinion, and I'm kind of glad that it will never do that, because that makes it a drug. And all of a sudden, then we can't talk about much of what we're talking about. I'd rather be a cellular, supplement, and this is the whole point of what I call connecting the dots. There are tens and tens of thousands of articles on redox biochemistry, redox molecular biology, and when you understand how cells work, the functioning of the cells, anyone can extrapolate that together and come out with the answers that they need. That's just such an important part of this. So we're never going to see those kind of studies, which is why it's important just to put this on board, improve your lifestyle, and get your cells functioning better. I don't know if I answered your question, but is that what you wanted, Jim?
Well, I mean, again, I don't want people to come into this and they have some serious condition. And
the reason why it always works, that was your question. The reason why it always works is because of what I just said. It works at a cellular level. It's like I call it the rules of the cell. When we think about if you jump off of a 10-foot a landing into the air, and it's 10 feet to the ground, is there any chance that you would float? Well, no, because the rules of gravity, the rules of physics are going to pull you down. There's physics is about time and motion and gravity and electrostatic forces, and those just exist. I don't care what you think about them. It's like I always told my kids when they started riding their bicycles, I said the rule of gravity always wins, so be careful. You have to obey that rule. And in the cell, there's these rules that work, and if we obey and follow the rules, then we tend to have health. And I realize it's a real simplistic thing, but people say, well, but it didn't do this for that, in a week's time or a month's time. Well, excuse me, it took me 2 years for my back to start feeling better. It took 40 years to get it this way, and to think that I can take a drug, if I did take a drug, I would expect it to work in 30 minutes, right? That's what pain management was all about when you're using pills. But in this regard, it always works at that subcellular level where those rules of the cell reign.
Didn't you get over your hump in your own back issue? I remember when you met Jim at a conference and you upped your amount each day. Jim started at 8. When you upped it, Lee, isn't that kind of when you got your turn? Like Dr. Walker says, every 3 hours, your redox's levels are dropping. So try to do, spread it out throughout the day. Don't do all like 8 ounces if you really wanted to see it.
Yeah, everybody's different with that. And we could get into the science some other time about what hormesis is, and everybody's different, sweet spot and so forth. But my point is, I went 2 years, 2 ounces twice a day, and I had very marginal, findings. I'm sharper, I'm quicker, my bowels changed, and so it wasn't like there was nothing. But when we were shut down in March of 2020, and I had 2 months off work, I thought I'm going to go get my neck looked at, because I'm with much discomfort, tingling, numbness in my arms, and so forth. Just being a dentist too long, I guess. And he informed me that I'd have between 7 and 10 levels fused, and I wouldn't go back to work. And so again, Jim's in the back of my brain saying, double it, double it, double it. Like, that's the story. So, because I thought, well, I'm not going to do that. I'm not ready. Kind of like Dr. Ed, I wasn't ready, to hang it up.
Yeah.
So I doubled it and did the Jim thing. And within 5 or 6 days, 99% of my discomfort and numbness and tingling was gone. and it's been that way since. So my point is that I had, even after 2 years of taking what I would call a minimal standard dose, I had to find out what worked for me, and I had to give it time. So,
when you said that, we need to shut it off. We're a little bit over, but I can't help but think of Donalyn Dominguez. She told me later that someone said to take more, so she doubled her dose. She said the only reason she did it was to prove me wrong. So we'll call it the Donalyn dose. So if you don't believe us, just keep doubling until it works, because I guarantee it's going to work, right, Ed? Right, Lee?
Yeah.
So, guys, thank you.
It was awesome.
Please get back to the one that got you on this webinar. We do this as a paying it forward to educate people. Ed, you were phenomenal tonight. This was absolutely awesome. Obviously, with Maureen and Lee and Ann, this is just really it's a fun thing to do. And next week we've got Dr. Dick Walker. I'm not sure if Nancy's going to be joining us, but Dick is just absolutely fascinating to listen to. We'll go into more of the nutrition and everything of that as well, and some of the new science. But a couple of warnings, please. Know where to go to do due diligence.
Yeah.
Don't go to Google just regular. You go to Google Scholar, go to PubMed.gov, or go to ASEAScience.com. But don't just go to Google. There's some silly people out there that write some stupid things that they don't want you to believe that what we have is real. Number two, do not go to Amazon to purchase this. Go back to the person that told you about this, because Amazon is not and never will be an authorized marketer of this technology. Maureen, Lee Osler, Dr. Ed, us, and all the other folks that are a part of this, go to them, respect that. And so with that, Maureen, Lee, Dr. Ed,
thank you.
awesome. So this recording will be up at Redox Matters probably within the hour or so. We thank you so much. We do this, guys, for you to invite people to come here to hear stories like this. You hear stories like this, I'm in. Sign me up. Yep. So, guys, thank you. God bless. And we'll see you back next Friday.
Happy Veterans Day.
Yes, happy Veterans Day.
Veterans Day. Thanks, Dr. Ed. Thanks, everybody.
Thank you. Thank you so much.
Thanks, Ed. You're awesome. Bye-bye.